Hello students, welcome to DBMCI MDS Experts. I'm Dr. Shilpa, your subject expert for public health dentistry. So we'll have the recall session for the public health dentistry questions of the INICET MDS May papers. And we at DBMCI MDS Experts are the first academy to have fully solved the INICET papers. So here, let me share the questions with you. The first question is, you need to collect DMF sample based on all age groups. Which sampling technique will you use? So is it choice A, stratified sampling, choice B, simple sampling, choice C, random sampling, or choice D, systematic random sampling? So systematic random sampling, it is a sampling technique based on which you select every nth sample. So you may be selecting every 5th sample or every 10th sample like that. So definitely it's not systematic random sampling. Here the question has told you need to select all age groups. So that means age groups can be subgroups or straight up. In choices B or C, simple sampling, random sampling, it's confusing. Simple random sampling is when you have a homogeneous population, you have a full population and you select a sample randomly. So the choice is choice A, that is stratified sampling, where one ensures that subgroups or strata of a given population are each adequately represented. So here it is age group within the whole sample population of a research study. Coming to the second question. So students, here 2 choices have been recalled. Please put in the comment section. However, these choices, it is based on identifying the probe with the correct markings. It is a CPITN or the WHO probe. These choices don't look right definitely. So I'm going to put the right answer for you. I'm going to discuss it there. So the CPITN probe or the WHO probe has a black mark or a band from 3.5 to 5.5 mm and additional rings at 8.5 and 11.5 mm, additional rings or lines or markings, however you call it. So the black mark or the black band from 3.5 mm to 5.5 mm is in the basic probe, that is the CPITN E probe, epidemiological probe. The additional markings at 8.5 mm and 11.5 mm are in the CPITN C probe or the clinical probe. The other specifications are that it is lightweight, that is 5 grams. It has got a ball tip of diameter 0.5 mm and maximum force, probing force can be 20 grams and so on. So that is about CPITN probe, which is from the chapter Indices. The first question here, we saw this is there in the survey chapter. So we saw 2 chapters now. We saw survey chapter. You can also see sampling. So if you look into index age groups, you will see stratified sampling in survey chapter. Also, if you look into sampling, it is there in the research methodology topic. So here we saw the indices chapter question coming. Now we'll see a probe question, which can be, you can see it maybe as a probe question in indices. It can come, not very frequently asked in indices, and it's more frequently a perio question. However, I'll discuss it here. It's an image-based question. Identify the probe. So you can see it's a curve. It has a curve here with some markings here. If you can see there are regularly spaced markings. The color difference, you can see you have a silver and black intersect markings interchangeably. So it is for 3 mm and that is why it is a neighbor's probe. Neighbor's probe is used for probing furcation lesions, silver and black increments of 3 mm. So the answer is choice A, that is neighbor's probe. Question 4. Which of this is not used to assess the nutritional status of a person? So you can see what is vital sign? You have your BP, respiratory rate, pulse. These are vital signs. So is it used to assess nutritional status? You have here choice B, C and D, weight, mid-arm circumference. Choice C, weight for height. Choice D, premature or low birth weight, that is weight, height, mid-arm circumference. These are all anthropometric measurements like height and weight. They are used to assess the nutritional status. So we're just not used to assess. Students, please look into the questions carefully always. Which of this is not used to assess the nutritional status? So the answer is vital signs. Nutritional status indicators like B, C, and D choice is not the right answer here, because which is not used to assess nutritional status of a person, the choice A, vital signs, is the right answer. Incineration is done for all except. So choice A, is it sharps? Or choice B, cotton soaked with blood? Is it choice C, human tissue? Or is it choice D, cytotoxic drugs? So choice B, cotton soaked with blood, is a category 6 waste under biomedical waste. So the chapter here is biomedical waste or hospital waste management. Choice C, human tissue, is a category 1 waste. Cytotoxic drugs are category 5 waste. So they are all, the mode of disposal can be incineration. So the answer is choice A, that is category 4, or waste shards, which are disinfected by chemical treatment or autoclaving or shredding or microwave. So that is shards like needles or syringes or scalpels, etc. Now we come to the next question from healthcare delivery. Vertical health program. So this is not a very frequently seen in our standard textbooks. So you need to know little extra now for your INICET. So vertical health programs are the programs which are used mostly for high priority diseases for better delivery of care. So the choices which makes most sense, the advantage of a vertical health program is choice B. Ability to respond to changing circumstances and the identification of new strategies due to which extra work can be taken in case of emergencies. So vertical health programs are standalone, categorical or freestanding programs for efficient and effective delivery of high priority diseases. Now we come to a question on general epidemiology, that is confounding bias. Which of this is true? So if we just define confounding, we'll get the answer here. So confounding is one that is related to both exposure and disease and is distributed unequally in study and control groups. So anywhere you have a choice left, students, of course it's a wrong choice only, but still if you want to recall, please put it in the comment section. We have an image-based question here. The image shown below violates which section of CODPA? So Cigarettes and Other Tobacco Products Act of 2003 enacted in 2004. So this image has been directly taken from Google Images, as we know now. So you can see a school here, Saraswati Balika Vidya Mandir, and you can see a shop here selling tobacco products. So which section of CODPA has been violated? So the answer is section 6B, that is prohibition of selling tobacco products within a radius of 100 yards of the educational institutions as per the section 6B of CODPA. To look into slightly further, the section 4 deals with prohibition of smoking in public places. Now we come to an evidence-based dentistry question, which is a level of evidence of a randomized controlled trial. So if you start from the lowest level of evidence like case reports, editorials, opinion papers, and you go to the highest level of evidence. So its lowest level is from 7 to highest level of level 1. Level 1 like systematic reviews and meta-analysis. So you have the level 2 for a randomized control trial, which is just below level 1. So the answer is level 2, which is the level of evidence for a randomized control trial. Level 2, evidence obtained from at least one well-designed randomized control trial or RCT is level 2. Next question, it is a little big question. So we look into the words properly. We have to note down some important words in this big question. In a planned tobacco cessation initiative. So we know it is a tobacco cessation program. They saw that betel quid chewing quitting has a response in lines that New cases of cancer is reduced. So we'll underline this, reducing new cases of oral cancer, reducing new cases. So new cases are reduced when you quit betel quid chewing. Reversing precancerous states. So it is seen that quitting betel quid chewing reduces new cases of oral cancer, reverses the precancerous states in a mass population where there is habit is there. So then they have a policy device to prevent the betel quid chewing. So stopping the habit, stopping the habit. So you can see it's in a mass population, a mass strategy, prevention of development of the risk factors or removal of the toxin or stopping the habit. So this is all in lines of a primordial and primary prevention. Prevention of emergence of risk factors in countries where they've not appeared, where it is fully integrated into the community-based programs for prevention of non-communicable diseases. Also, please note this is all in the pre-pathogenesis phase of the disease, whereas secondary prevention is in the early pathogenesis and tertiary prevention is in the late pathogenesis phase of the disease. Next question. An orthodontist uses fluoride varnish and fluoride mouth rinse before application of brackets for fixed orthodontic therapy. So what happens? This will prevent formation of white spots, preventing formation of caries. So prevention of formation of even initial caries. So this is pre-pathogenesis. So that is primary prevention. Coming to a biostatistics question, normal distribution is best described as. So please don't get confused. The choice correct answer is A. In a standard normal distribution, also called as a Z distribution, you have the mean as 0 and standard deviation as 1. So the choice is A. Correct choice is A. Now we have a health economics question related to cost utility and cost effectiveness. We'll discuss in detail in your coming sessions. So I'll just put the choices I don't have. You can put it in the comment section. I'll just discuss what it is. So you have cost utility analysis where the cost incurred in the intervention is measured against the utility. For example, you have a program of Pitt and Fisher sealants. You look into how much cost went into the full program and you measure it against how well the quality of life improved when the caries was prevented. This is an example related to oral health. Also, generally, you can see the QALY and the DALY measures, indicators, how the cost incurred in the intervention is measured against the utility related to the health. Whereas cost effectiveness you measure, when you measure the cost that went into the program and how effective the final consequence was in reducing the disease or like that. Like you check the effectiveness as a final consequence of the intervention. So we will discuss this in detail in health economics chapter. There are other terminologies also to be discussed, which we'll discuss in detail in health economics section. Now we come to a concept of health and disease, particularly we'll look into each of the choices, impairment, disability, handicap, what is each? So impairment. So the question is loss or disease present due to congenital birth defect means what? So impairment is loss. So the answer is very clear cut here. It is choice A, impairment, because you see a loss of anatomical structure. Loss, that is impairment. So loss or abnormality of psychological, physiological or anatomical structure function is impairment. Coming to what is disability, inability or lack of ability to perform an activity, inability to speak properly. That is a disability. Whereas the handicap is a disadvantage in fulfilling the role of that individual. Maybe preventing to fulfill the role properly as a speaker. That is a handicap. Impairment is loss of tooth. Inability to speak is a disability. Like that. So the correct choice is choice A. Now we come to the next question on epidemiology and prevention of dental caries chapter. So which of these was the aim of performing the Vipeholm study? So if you see the choices of role of water fluoridation assessment, Definitely, it is not an aim of Vipeholm study to assess the role of water fluoridation in caries activity of children. This is not the right choice. To assess the role of xylitol, that is also not right choice when it comes to Vipeholm study. So if you look into the aims of Vipeholm study, you had quite a few aims. One of that is to assess the role of non-sticky sugar. You have other aims like to check the role of sticky sugar in between meals, so on and so forth. So the choice B is the right answer. Now we come again to biostatistics question. Mode is. So mode is a value of central tendency. You have other values of central tendency like arithmetic mean and median. Mean is the average value of the sample. Median is the middlemost value in a set of observations. So the most repeated value of the sample is mode. Choice B is the right answer. Now we come to caries activity test, which comes in prevention of caries part in epidemiology of dental caries chapter. In Snyder's test, which is a caries activity test. So we are measuring color change. As you know, we are measuring color change from green to yellow. And it is assessed at 24 hours, 48 hours and 72 hours. So here they have asked color change at 48 hours signifies what when it comes to interpretation of caries activity. So if you want to improvise the choices, please put it in the comment section. This makes more sense. So definitely the answer is definite caries activity, because 24 hours, if the color change happens, it is marked caries activity, and it is limited caries activity if the color change happens at 72 hours. So the correct choice is B. Definite caries activity is seen when the color change from green to yellow happens at 48 hours. Next question on fluoride. Specifically, we'll look into fluoride toxicity and acute fluoride toxicity. So they have two statements here. First, hepatotoxicity is seen within 6 hours. Neurotoxicity is a delayed feature. So as you know, these both choices, the choices, are they right or wrong is a question. So we know that yes, both choices are right. The answer is choice A. 1 and 2 are correct. So specifically what you need to know here is the kidneys followed by the liver accumulate more fluoride than any other organ system in the body, and therefore they are the most vulnerable to the effects of fluoride toxicity. So the choices A, 1 and 2 are correct. First, hepatotoxicity is C. Now we come to again a general epidemiology question. So difference, the word difference, the difference in exposed to unexposed individuals. So please note the difference in incidence of disease is something which I'm understanding. You have to improvise here. The difference in occurrence of disease or the difference in the incidence of disease in exposed to unexposed is based on. So coming back to your basic concepts of relative risk, attributable risk. Because you know here choice B is same as choice D, relative risk and risk ratio is same. Odds ratio is the strength of association of exposure and disease that comes in cohort study. Relative risk, more specifically, is a risk that gives you very important clue on the etiology of the disease. That is relative risk. That is incidence of disease among exposed by incidence of disease among unexposed. That is relative risk. Whereas a difference, that is attributable risk. That is incidence of disease among exposed minus incidence of disease among unexposed by incidence of disease among exposed. So the correct choice is choice A, that is attributable risk. It is also called as risk difference. Risk difference or attributable risk is defined as a difference in the risk of a condition such as a disease between an exposed group and an unexposed group. Let us take an example, tobacco chewing and oral cancer. So if you speak about the effect of tobacco chewing and oral cancer in terms of attributable risk, you are making a better public health significance. If you look into the public health significance, attributable risk is better compared to relative risk. Relative risk is definitely good when you talk about the etiological importance effect, whereas when you tell that among the chewers who develop oral cancer, for example, 80% is attributed to chewing in among those who get. So the attributable, that makes a better public health significance. So students, please don't forget these formulas. So all of these we are going to discuss in our sessions. I have already discussed so many chapters with you in detail. We'll look into each chapters and we'll discuss each in detail. Coming to our next question. Helsinki Declaration related to ethics. So it is definitely not choice A, biomedical base, it's wrong. So is it B or is it C? One more choice, please put it in the comments. But definitely the correct clear-cut answer is Helsinki Declaration is related to ethics in medical research. Helsinki Declaration is related to ethics in medical research. So there was a code of ethics related to medical research that was given forth by Helsinki Declaration. We'll see in detail in ethics chapter. Coming back to biostatistics, simplest measure of variance is. So measures of central tendency I already discussed. You have mean, you have median, you have mode. Measures of dispersion or variance. You have standard deviation, you have mean deviation, you have, yes, simplest measure is range, whereas mean and median are measures of central tendency. So the correct choice is choice D, that is range. Coming to a question on screening, formula for negative predictive value is. So we'll discuss in detail sensitivity, specificity, positive predictive value, negative predictive value. So to discuss very shortly, what is negative predictive value? First, you need to know this 2x2 table. I will discuss this 2x2 tables in detail in screening as well as in epidemiology chapters. So just to show this 2x2 table to you, you have a screening test, you have a gold standard. Suppose your screening test is like an exfoliative cytology or a pap smear or an exfoliative cytology of a swab that you took from the inside the cheek for a screening oral cancer. Just as an example, I'm telling you. So please remember this 2x2 table very clearly. Test positive, test negative for the screening test comes in the left-hand side. And the gold standard of the biopsy gold standard results, disease present, disease absent comes here above. So when you compare the screening test results with the gold standard results and you find screening test positive and disease present, it is true positive. When screening test result is positive and disease comes as absent, it's a false positive. Screening test negative and disease is present, it's a false negative. Screening test negative and disease absent, it is a true negative. A, B, C, D. So your formula you have to remember based on this 2x2 table. So the negative predictive value is a proportion of people who is screen negative who are actually free. So your denominator is true negative plus false negative and your numerator is true negative. So true negative by true negative plus false negative, that is choice A. So students, here we come to the end of our questions and discussion, and any further discussions or anything that you have to put among the choices, please put it in the comment section. And definitely in our classes, our regular classes, will be discussing each of these chapters in detail. We'll be discussing MCQs in detail. So there we come to the end of the session. Thank you.